I always like to start with something a little bit personal. You probably get the feeling that you have this researcher in front of you who's probably sort of like a geeky kind of person. And, you know, considering I also have a telecommunications and electronics engineering background, that's probably true. But just to make it even more so, I'll tell you, I was thinking that, you know, someone asked me the other day what were significant things that happened to me in my life. And I thought, boy, you know, one is definitely the birth of my twin sons, okay? But, you know, they're 15 now, so I live with 2 teenage boys. So if you ever, like, you know, see me running around like a, you know, looks like I'm sort of crazed, now you know why. The other thing, other event that struck me, and this is going to sound really strange to some people, but really interesting to others, is the day I opened an email at 7:30 in the morning, and it was from a government official, and all it said was, if you were to design a subsidy for New York City, what would you do? Okay, so that's one of the most significant events in my life. So now you get a feel for who I am. Okay. I like to really sort of think about these problems in a different way, and coming from a research perspective, you sort of have that time and the ability to do that. So I'm going to talk to you about a few things today. One is a little bit about the original research on the family critical time intervention, because I think it's relevant to the discussion of rapid rehousing for several reasons. And the other is I have some sort of questions I'd like to pose in a little more theoretical discussion, which I always feel is sort of my role on these panels. Okay, so my experience with rapid rehousing is as the researcher who developed and originally tested the family critical time intervention, and I have to say it's extremely gratifying, rewarding to know that CUCS and people all over the US and in Canada, and I actually just got an email from the Netherlands. They're using with domestic violence families, so that's a great thing. We started this work in 1999, and we started it with the challenge of trying to look at a shelter system that was growing rapidly and that was sort of bulging, and they were not having a lot of success in having more families move out. This was a family system, then move in, and they were really, really struggling with what to do. So we actually had the availability of a grant for 2 years to go in and just really think about it, look at the system, and try to decide what interventions we thought might be able to help them to relieve the tension on that system and move them forward. Maybe change some of the thinking as well. So we did that for 2 years, and we came up with 3 goals. One was that we wanted to see if you could take the critical time intervention that had been used with homeless single adults, move it into the family realm. So we wanted to test that. Another goal was to relieve the pressure, as I said before, on the growing shelter system. The third was to challenge the assumption of the housing readiness criteria in that system. And you might say, as many people tell me, everywhere I go, oh, we don't really have one of those. But if you have any subsidies, or you have any programs in your community, or you have any ways that you are assessing or determining what types of subsidies or assistance families are going to get, and which in many cases determines how rapidly they can move out of housing, you have a housing readiness criteria. In this case, this shelter system had a written housing readiness criteria. They had a nice form, and they filled it out, and then at the bottom, the caseworker or the assessment person checked housing ready or not housing ready, and that determined whether or not the family had access to whatever subsidies or other rent assistance programs that they had available. Lots of systems look like that. There are places that still look like that. When we went around in that system and we interviewed and did focus groups with staff, what did we find out? Oh, you know, well, we don't always use what that form says. Okay. Oh, you know, I had this family, and the mom was so persistent. She came to see me every day, see if I'd change that check on her form. And when I wouldn't do it, she kept after me, and eventually I just got her a voucher. So the housing readiness criteria that they were telling us about wasn't necessarily guiding, number one, guiding their decisions. Number two, I would surmise that in most places it's not really based on real good data about whether or not someone who's homeless or a family who's homeless should have readily access to housing. Most places in the country now, a lot because of what the federal government has done, this is no longer a lot of a debate. Housing first, rapid rehousing has changed a lot of that discussion. Here in New York City, however, we still have various discussions about this. We still have debate. I don't think that we have a lot of evidence that people who are homeless don't need housing and don't need it now. And that's really where I come from with this argument. If you could show me that not giving housing to someone who's homeless or a family who's homeless is a good thing, and you can show me the evidence, I would be much more willing to listen to that. But I've yet to see it. Okay, that's enough pontificating from me. So the original study with family critical time intervention was a randomized trial. We had 220 families in the study. These were all identified as high-need families by the system that we were working in. They had certain criteria. Also, our grant funders, we agreed on criteria with them for what we would call high-need families. So we had restrictions. We could only take families that the shelter system considered sort of at the bottom of their pool in terms of readiness. They had to have an active mental health or substance abuse problem. And there are other criteria also. The experimental group in this study received the family critical time intervention, and they also had a rent subsidy. The goal was to move them out of shelter within 6 to 8 weeks. So I sort of think, like, very often that this was one of the first uses of rapid rehousing. We started this, quite some time ago. It's almost 15 years, right? We're getting there. So the goal was to move them out quickly. And as you can imagine, in this system at the time, when people thought that the families we were specifically identifying needed to stay in shelter longer, people were very much up in arms in the county where we did this. They were not so happy about it. They thought that the families would fail. They didn't think that families with these types of problems could live out in the community until they were ready. I'm not sure how they were getting them ready, but that was what they said. Our control group for the study got services as usual in the county. And, it was a very interesting thing happened. Lo and behold, about halfway through the study, the county got the ability to release a backlog of Section 8 certificates that they had been holding that they weren't allowed to use for they had done something, with HUD. So they were about to release them. And who did they decide to give them to? Well, they had been watching what we were doing with the families who were in our experimental group, and they thought, we don't really see those families coming back to shelter. And we had identified those as families that probably weren't going to do well. We had a very, very low return to shelter rate. So they started giving a lot of those vouchers to families who were the hardest to serve. So in the middle of our study, there was this big switch to now having a study that pretty much was only looking at family critical time intervention with housing versus housing without family critical time intervention. It's not a bad model for a study, but and I'm glad that all those families got their vouchers, but as a researcher, it's a little bit complicated. It was very interesting because the system started to turn around their thinking about these families. And what were the results? The family critical time intervention families did better on some outcomes. We had less returns to shelter, which was a good thing. But and I can tell you that the most significant outcomes we had were about the kids in the families, which I think is really very interesting. And that work I did with Beth Shin, who some of you might know. She used to work in New York. She's now at Vanderbilt. But overall, people who worked in the system, they were really, really surprised at this outcome, that you could help families move very quickly to housing and that most of them would be okay, especially the families that they considered to be the bottom of the pile. And I really think it was a very big change in philosophy. Did these families look like lower middle class or middle class families after 18 months? No, they didn't. Did they look like their other poor neighbors who were staying housed? Yes, they did. I bring that up because I think sometimes part of our goals for families who are homeless, we have to be very careful about what goals we set. Are we setting a goal that makes sense so that we can help more families and help them on their way? Or are we trying to reach even higher and trying to really solve some of the issues that are more maybe related to poverty? And I feel sometimes that the field sort of gets stuck in that mire. Having a goal that you earn $24,000 a year is not a lower middle class income, but you can have stability with that. So to me, that makes sense. Okay. Now, Bob mentioned this before, and I think it's really, really important. One of the things I wanted to talk about a little bit is What about the fact that he says 85 to 90% of the families succeed? Well, that leaves you 10 to 15% who don't, right? Okay, so everybody says, well, it's not going to work for everyone, but we know it's not going to work for everyone. And you have to consider rapid rehousing as you should consider permanent supportive housing, as you should consider family critical time intervention, tools in your toolbox. And if you have a system that's well organized, you can try to use these in appropriate ways and for the people who most will benefit from them. I wanted to use one example from the SSVF program, not to bash on the VA at all. I have a number of sites that I work with, one in particular in California that's doing SSVF with families. And when they applied for SSVF, in the original announcement, it did talk about options for serving families, and one of them was critical time intervention, and they said that they were going to do this. And so I've been out there working with them a few times, and one of their problems is that while they try to analyze and assess families when they come in to determine who really needs this longer period of assistance, because family critical time intervention is 9 months. You can shorten it some, but it is a 9-month intervention. And the SSVF through the VA would really like their intervention to be shorter. They say shorter on average, which means that you should have some maybe that are 3 months and some that are maybe 9 months and maybe some that are 12 months. But they've been really, really pushing certain organizations to try to see if you can do it shorter. And I completely understand that. I think that if you can shorten the amount of assistance, because we never really know how short we can make it, and families can still do fine, that's a good thing. But if you have a way in your community to identify families or individuals that you think need longer term care or longer services, maybe you should be able to do that a little more. So they are trying to really hone in on what families they're going to assign to family critical time intervention under their SSVF grant. And they're getting more and more successful at that, I think, over time. So that's sort of a combination between rapid rehousing and then using another tool. And as I said before, these are some of your other tools. Bob also mentioned progressive engagement. Funny thing about progressive engagement is it's almost in a way the opposite of critical time intervention, right? Because with critical time intervention, you try to identify somehow people who have high needs, and then you give them intensive services and you try to taper them off over time so they get used to being there, out there in the community without you, and having connected them to other providers and services when you leave. And the theory of progressive engagement is you may not know that people have higher needs until they're out in the community, but when they do show that they have higher needs, you want to be able to provide them with more supports over time. I sort of, in my mind, I think, wow, maybe you could do both, right? You could have, like, do progressive engagement to really figure out who really needs it, and then for the really high need families, maybe you try critical time intervention, and then that stays with them and it lowers over time. But for the families, we always stress very much when we talk to people about the intervention, at like around month 6 of a 9-month intervention, if you think a family still after 9 months is going to have a lot of trouble being able to maintain their housing or get their kids to school, that's another really good marker. Then we say they might want to think about permanent supportive housing. So my description of this is one where you take your tools, you patch them together in a logical way, and you make sure then that the resources and the funding that you have, you're trying to gear it towards the people who really do most need it. One of the problems I have, or issues I see, I should say, with how we assign families to permanent supportive housing, for example, is that many communities have an assessment that they do, and they determine while families are homeless, which families should move into permanent supportive housing. But you may not know this for a while, and we don't really know what a high need family necessarily is.